CPT JJ-CPB, Evaluation and Management, E&M, Services Guidelines, page 6, part 4. We're talking about history of physical illness, right? The history of the disease, right? What is that?
A chronological description
Means order by time. The oldest one first, and then you go as time progresses, you just keep describing and describing. That's chronological description of the
description of the development of the patient's present illness.
Right, the reason why the patient is coming to the doctor from the first sign.
And or symptoms to the present.
Yeah, from the first sign of the disease until now, right? What happened? That is a history, right?
Right.
Now this includes a
description of location,
where,
quality,
how much,
severity,
how bad,
timing,
for how long,
context,
with in what situation it happened,
modifying factor,
what else happened,
and associated signs and symptoms.
What are you feeling, right?
Yes, significantly related to the
presenting problem, right? Okay, so that's basically what is a history of physical disease. The history, right?
Right.
The history, and the next part we're going to see is the physical, but the first part is the history. Just tell us what happened. How did it start? And what happened? What are you feeling? All in chronological order, right? And now, if you want to read anything more about this, we have here a graph of the questions that the doctor usually asks to get the history, right? For example, let's do just the first one. When did the problem start? Do you remember when it started? Was it yesterday? Day before yesterday? A week ago? A month ago? A year ago? You always had it? That's when it started. What did you notice first? What did you notice? Was it a pain? Did it a swallowing? I mean, not swallowing. Something that went wrong, like red, or something in your skin, or anything that you noticed that was wrong. What did you notice first, right? And then the other question, so you can read it for yourself. So that's our theory. Now we're going to do a problem. So ready, set, go. Okay, this is CPT JJ-RVA-280. That's the page. 191 is the exercise, the level 2, which means that it's a little difficult. It's not straightforward, has some difficulty. And the title is Laceration, and it's medical, right? So, let's read it. Review.
The patient is on vacation and presents to a physician's office
with a
lacerated finger.
Lacerated finger. Okay, there are two keywords here. He presents to a physician's office, right?
Right.
And lacerated finger. Okay, keep going.
The physician repairs the laceration and gives a prescription for pain control. And has the patient follow up with his primary physician when he returns home
from his vacation, right?
Right.
Okay.
The physician fills out the superbill as a problem-focused history and physical examination with a straightforward medical decision-making.
Okay, these are the three important facts that help you to find a code, okay? History, problem-focused history. 1. Problem-focused physical examination. 2. A straightforward medical decision. 3. Remember those three factors? With those three factors, you can find the E&M code, the Evaluation and Management code, right? So that's the first code. The next code is what the patient did, right?
Right.
Or what the doctor did, I'm sorry. So, what is that there? Also checked is
a laceration repair for a 1.5 centimeter finger wound.
Finger wound, right? So, laceration, right? And they give you the area of the wound for 1.5, which is very important. Okay, so that's the problem. Now we are going to count to 3, so you can pause the video and give us the CPT code or codes for this complete visit and treatment, right? So 1, 2, 3. Okay, there are two answers. The first code is the E&M code, which is 99201. And the second code is the code for the treatment, right? 12001. Okay? So you got that? You got it. Congratulations. You can go to the next video. If you didn't get it, let's just give you a couple of tips. Tip number 1. L2 difficulty.
There are 2 codes.
We want you to code a superbill means the complete visit. The E&M code, which means what kind of evaluation and management visit this is, and the procedure code and what was it done to the patient. So it needs 2 codes. That's what we have level 2 difficulty, right? Okay, number 2, for the first code.
For the first code, start with evaluation and management.
Yeah, the E&M code, right? And remember the 3 words that we told you. Focus, problem focus history, problem focus physical, and straightforward medical decision. Those 3 words or those 3 keywords will help you find the code, right?
Right.
Okay, now that's a E&M code. Now for the second code.
For the second code, start with repair wound.
Wound. Now it doesn't say repair laceration, but a laceration is included in wound, right? It doesn't specify that is specifically laceration, but a laceration is a type of a wound. So laceration is included in wound, right? And then another thing is if it's not specified repair, it is what?
Specify repair. Repair is simple repair.
It's simple repair, right? It doesn't tell you it's simple repair, but it doesn't tell you that it's a complex either. So if it doesn't tell you, by default, just choose simple repair. Okay, because if it were complex, then they would have to tell you in the text, but they don't tell you. So by default, if they don't tell you what kind of repair is, then choose simple repair. Okay, now you got that, you got the tips. Now for the videos, we just got 1 video from that coding course, right? That is very good about medical decision. We couldn't find any other specifically related videos, but we found some for extra information that you can just look at them and click and see where they leave you. Okay, so now you have everything. You have the tips, right? You have the links that will tell you to understand the problem. We show you how to understand the problem, and you have the answers, 99201 and 12001. You have everything. Now we're going to count to 3 so you can pause the video and then give us the path, how we got to the answer. Okay, so 1, 2, 3. Okay, this is the summary of the whole problem. It's a review, and the patient is on vacation and presents to a physician's office with a lacerated finger, right? The physician repairs the laceration and gives a prescription for pain control and has the patient follow up with his primary physician when he returns home. The physician fills out the superbill as a problem-focused history, problem-focused physical examinations with straightforward medical decision making. Also checked in the superbill is a laceration repair for a 1.5 centimeter finger wound. Okay, so we want you to code those 2 things. For the first code, the code 1 through the index is found like this.
First you go to index.
Go to the index.
Then you start with evaluation and management.
We are going to describe what type of visit this is, so that's why we need to go to evaluation and management. And then we go to
office and other outpatient.
Is office and other outpatient, which means this is not a patient that is inside a hospital staying overnight. No, he just went to the doctor's office. That's his office and other outpatient, right? So now we get a range of codes, right? From 99201 to 99215, right? So we're going to have to go to the tabular to see which one is the one that we need. So the code 1 through the tabular is found like this.
Okay. First you go to tabular.
Go to a tabular.
Then you go to 99201.
Yeah, and you start looking at all the descriptions, right? The first one is what?
New patient.
This is a new patient because the guy is on vacation. He's not in his town. He's on vacation. You're supposed to take vacation outside of your city. So you go to a doctor that has never seen you. So that's why you're a new patient, right?
Right.
And then?
Office or other outpatient.
Which is our problem or our situation. And then?
Problem focus history. Examination. Straightforward medical decision making.
I think we have everything there, right? But just let's check the next one to see why is it different. The 202 is what?
202 is expanded history.
Expanded history. It's not expanded. This is just problem focused, right?
Right.
The 3 is what?
Detailed history.
Detailed history. It's not detailed. It's just problem focused. So that's why we go back to it. You can check the other ones, but you're going to find that all the other ones have something that is not in our text. So we just go back to 99-201 because we have everything there. We have is a new patient. It goes to an office. It's a problem-focused history, problem-focused physical examination. You probably are missing physical examination here. Can you put physical examination there? Physical examination and straightforward medical decision making, right? Those three things give you that code, and besides that, it's a new patient, right? So that's why we have the E&M code. Now, that's the code for the visit, the type of visit. But now something was done to the patient, the procedure. So we have to code the procedure too. So the code 2, or the second code for the procedure is found like this. The code 2 through the index is found like this.
First you go to index.
Go to the index.
Then you go to repair.
The doctor did a repair. A repair of the what?
You go to wound.
Of the laceration, right? But there's no laceration because the laceration is included in wound. It's a wound, right? So, and then we choose what?
And we go to simple.
Simple because it doesn't specify what kind of repair it was. When it doesn't specify, by default, you go to simple, right? And then we have a range, right?
Yep.
12001 to 12021. And how this range changes, we got to go to the tabular for that. So the code 2 through the tabular is found like this.
First you go to tabular.
Go to the tabular.
Then you go to 12001.
You start with the first one in the range that you found from the index, right? And what is that? It's the same description that we need, but the only thing different here is the size, right? The size of the area. This is 2.5 centimeters or less. Ours is 1.5, so it's included there, right? But let's check the other ones just in case.
Okay.
Why don't you have the code here?
Oh, oops.
Pause it, please. So then we're reviewing the codes, right? So the next code is 12002, and the only difference here is the size. This is from 2.6 to 7.5 centimeters, which is bigger size than we have. We have 1.5, right? The next one is the same thing, is a bigger size only, right? So we go back to the first one because that's the one where we have everything, right? We have a simple repair, the extremities, including hands and fingers, right? It's a finger here, right? So that's what it was repaired, a laceration. So 2.5 centimeters or less, that's why we have the code 12001, okay? So that's how you find the second code, and the answer again, can you show the answer again, is 99201, which is the code for the E&M, or the evaluation and management, and the 12001 is the code for the repair of a laceration, a simple repair of a laceration from 2.5 centimeters or less, right? So that's our answer. Thanks for watching, and don't forget to visit our website, and also you can subscribe to our videos by clicking here in the subscribe button, and you will get
up to 3 videos every day that we make. ICD-10, CPTs, all that's needed to pass the medical coding certification exams.
Thanks for watching there, and don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.